We'll be beginning our program in 2 minutes. Thank you. Good morning, everyone, and welcome. I'm Sarah Cott, SVP of Programming at The Hill. Thank you for joining us in person this morning, and thank you to everyone joining us online for our event, Dialing into Mental Health, 1 year of the 988 Suicide and Crisis Lifeline. I'd like to thank our sponsors, the National Alliance on Mental Illness, for their support of this discussion. Today, we will be joined by lawmakers, mental health experts, and advocates to mark the milestone anniversary of the 988 Suicide and Crisis Lifeline and discuss what still needs to be done to ensure everyone can access the help they need. One program note, Republican Congressman Chris Stewart will not be joining us due to a last-minute scheduling conflict. Before we get underway, a few housekeeping notes. If you are with us in the room, please keep your phones on silent for the duration of the program. But we do encourage you to join the conversation on social media. You can follow us on Facebook, Twitter, Instagram at The Hill Events, and we will be using the hashtag #TheHillMentalHealth. And with that, I am delighted to kick off our program. Joining us virtually is Xavier Becerra, Secretary of the Department of Health and Human Services. Bob Cusack, the Hill's editor-in-chief, spoke to him yesterday.
Mr. Secretary, thanks for joining us.
Bob, thank you.
I want to talk about mental health, but I do want to get some news of the day, news of the week, and it pertains to COVID, which obviously factors into the mental health debate and question and solutions. But Energy and Commerce Republicans this week are claiming that HHS broke the law by not reappointing certain officials at NIH, including Dr. Fauci. They say that move was unconstitutional. I want to give you a chance to respond to that. I imagine you don't agree with that perspective.
We continue to do the work we must to protect the American people. We do it following the law, and we do it with the greatest professionals, including Dr. Fauci, to make sure that we protect the health of all Americans, including those who might suffer from COVID. And so, if I could say, Bob, one last thing, please get vaccinated as we prepare for the fall flu and virus season.
But as far as the reappointment, you think you're on solid legal ground there?
We continue to do the work just as any other administration has, making sure that professionals that are committed to working as part of the federal government do their work and do that under the law.
The pandemic is over, Mr. Secretary, but I just had a family member who's contracted it. Where are we and where are we going on COVID-19?
Well, COVID is with us, and Bob, you're again stating the obvious fact that COVID is with us. We know how to tackle it, manage it much better than we did 3 years ago, but it's still with us, and it still can be deadly. It's still killing some Americans, far fewer than ever before, but it's still killing. And so that's why we have to stay prepared, just as you have to be prepared for any onset of the flu, especially if you are immunocompromised. And please don't fail to recognize that COVID's still out there. Protect yourself. The best way to protect yourself is with the latest version of the vaccine.
Let's go to the first year of 988, which is, I think, a fantastic idea. Everyone has been affected by mental health, either personally or they know a family member. Let's assess the first year. What has worked and what more needs to be done?
Yeah, and Bob, I think we really do have to put this in context. 9 in 10 Americans, when you ask them, will tell you that America's facing mental health crisis. Every 11 minutes, we lose someone in our families from suicide. And so this is critical. And what we're trying to do is tackle it in 2 ways. One, grow the workforce because we know we don't have enough mental health professionals today. But 2, it's give people the equitable access they need to mental health. You break your kid breaks his arm, you know, you're gonna go to the hospital, they'll get it bandaged up, put a cast on it, and the arm will heal slowly. But if you're hurting, mental health, depression, it's unclear whether or not you're going to actually access a mental health professional. Those things have to change. One of the first things that the president wanted us to do is make sure people had early access. And so that's why he invested so heavily in 988, the new suicide and crisis lifeline that makes it possible for Americans who are hurting, who are about to go the wrong way in that fork in the road, to say, I'm going to call 988. Like 911 for emergencies, 988 for mental health crisis is now there for you.
And that is a great thing because the other number was very forgettable. Regarding, though, the awareness of it, the percentages of how many people, I believe it's around 13%, know of 988. So what has to be done there? Yeah, well, just this, what we're doing today is helping communicate to people what 988 is. Remember, 911 didn't start off with instant success either. It takes a while. There has been a lifeline number for many decades. It's just that who can remember the 10-digit number, and depending on what region of the country you're in, you had to dial a particular number. Now it's simple. Across the country, 988. And more our state partners, who really are the ones who on the ground operate most of the 988 centers, are coming up. They're picking up the slack. They're becoming more committed to devoting resources to 988. But until then, the fact that President Biden has put in close to $1 billion in his time in office for 988, compared to the previous year before he became president, when only $23 million were devoted to 988. You can see that President Joe Biden is going to make sure that people can get their mental health care crisis addressed. Mental health, of course, Mr. Secretary, was something that was a major problem and dilemma. And as you say, 9 out of 10 people think we're in a mental health crisis in this country. Let's talk about COVID-19 and the effect of it on mental health. On one hand, I think more people are talking, and we've done a number of events that touched upon mental health during the pandemic. More people are willing to talk about it. I think there's less of a stigma, but at the same time, it really did not help a lot of people, specifically children, and I know you have programs that are designed to help children.
Yeah, isolation can sometimes be deadly, and stigma can really kill. And so it's great that we're beginning to open up, that leaders throughout the country are speaking publicly. People who are role models are talking about some of their own experiences and past, and it's becoming clear to those who are hurting that they're not alone. And that's what becomes very important, is to really break down that stigma so people will open up, because the reality is oftentimes someone needs to just be able to connect. And then if we see that it's more severe, get them the health professional that they might need to work with. But the first thing we have to do is get people to recognize that they can open up. Second thing is to make sure that they know when they open up, someone who cares and who could be trusted will be there to help out.
You're the first Latino HHS secretary. How is mental health, has it disproportionately affected minorities? Obviously, mental health is a problem across this country, but I wanted to touch upon that.
In a way, yes, because like other circumstances involving healthcare generally, minority populations, those who are less advantaged, are always the last to get the support that they need, the help that they need. And so in minority communities, especially the Black and brown community, what you find is that mental health is less available to them than in, say, the white community. We're trying to change that. There's also the issue of stigma, oftentimes based on cultural background, particular tendencies within a community, there's oftentimes a less willingness to open up on some of these subjects. I know that when I was young, I remember I'd always hear the words "aguántate," tough it up, tough it out.
Right.
You can handle it. That was the way to deal with some of these internal crises that you might have. Today, we know that we have to really work with people. And so I think the more we reach out to people, the more we're not only going to be able to create a healthy America and a healthy economy, but we'll reach those who often get left behind.
What would you tell someone who's watching this right now, other than calling 988 if they're really in tough shape, but day to day, going through struggles? What can they do? What would you advise them?
There are places they can go. There are people they can see. It's no longer as it was maybe 20 years ago, where it was a desert when it came to finding the mental health help that you needed. 988 is really a godsend, because it may not be the solution, but it lets you touch someone who can send you on a path to where you will get the help you need. And what we're doing now is establishing, with the help of Congress, crisis care centers that are open 24/7. When you're facing a mental health crisis, it's not just between the hours of 9 to 5. And so you can't afford to have a center have the closed sign in front of the door when you're suffering that crisis. And so today we've established mental health crisis centers throughout the country that are 24/7. Critical care, in some cases mobile care. And so we're trying to go to where you are. And so the help is there. We still have to work hard to grow that workforce and the mental health care capacity. But unlike a couple of decades ago, today, if you reach out, someone will touch you.
What about stakeholders, whether that's in the business community or consumer advocates? Has HHS worked with them? What can they do to help quality of life?
That's right. And more we're going to do that, because you talk to any employer, the sound mental health of their employees is critical if they're going to have success and be profitable. We understand that in schools, if your children are not ready to learn because they're suffering through crises, mental health crises, that it's tough for them to become the leaders of tomorrow. And so more and more we're reaching out, because mental health is that hidden enemy that sometimes makes it possible for America to be all it can be. And so we're going to get out there and work with everyone who's interested, but certainly at HHS, our work is healthcare, so we're going to do everything we can within the healthcare sector to, as I said, grow that workforce and make sure that there are the professionals out there that people need.
You were a leader in Congress. What is Congress's role here? What would you like to see this divided Congress do?
Well, I simply will tip my hat to those members in the House and the Senate who, over the last 2 years, gave us the resources that the president asked for 988. $1 billion is quite a bit of money, especially when you compare it to the 23 million or so that had been devoted in the year before the president came into office. And so Congress had to make it possible. The president requested, fought for it. Congress gave us the $1 billion to stand up 988. We also received support from Congress to stand up these critical care centers that I tell you are 24/7. That, without Congress's help, would not be possible. And certainly we're going to look to Congress to help us grow the pipeline of professionals we need for mental health care.
As you know, Mr. Secretary, there was a big deal, bipartisan deal on the debt limit. Now there's dispute over kind of what those terms were, and there's growing fear of a government shutdown. Are you concerned about HHS's funding, especially with the House being run by Republicans and really targeting departments like yours?
Look, we do work that keeps people going, keeps people working, keeps people alive. We work with our states. We don't do the work directly, because it's really the states that have jurisdiction over healthcare. But with our resources, like with 988, we make it possible for states to have success. The worst thing we can do is turn off that spigot that gives us the resources for our states to support the healthcare, mental health care of all their populations. What we did in saving lives under COVID, the pandemic, what we've done to expand the number of Americans who have access to health care, Today, there are more than 300 million Americans who have their own insurance to go to a doctor or a hospital. Never before in the history of the country can we say that there were more than 300 million Americans who had their own health insurance. We can't go backwards. If we see Congress begin to dismantle those investments, who's going to hurt? Well, the American people will hurt.
As far as, I know you were giving advice before, but how do you handle stress? You've got a stressful job. I watched some of your congressional testimony. It gets, there's some conflict, but that's what Washington's about. How do you handle it on a day-to-day basis? I think our viewers would want to know.
Bob, I'm not sure I have the direct answer. All I can tell you is that when I go home, my wife and I have been together for decades. My 3 daughters, I think, still love me. If I have a home, that's all I need. There are a lot of folks who can't even say that, right? They have a home they can go to. When I say home, I don't mean a house. I mean the people who I love and who love me. And as tough as the job may be, there is something very comforting about being able to go home and be loved. Last question. Can you tell us about what you've gotten as far as feedback? And I know we talked about how 911, a lot of people didn't know it. A lot of people still don't know what 988 is. And hopefully after this event, a lot more people will know. But what are the success stories? Because suicide is such a tragedy. It affects everything, especially the military. What have you gotten some good positive feedback on, wow, this has been really helpful for me? I had a session in Philadelphia where we were talking to families who were the victims of a violent death of a relative. And it was with children, we were talking with children, and there was this one little girl who talked about losing her older brother to gun violence. And he was her role model. And he had actually begun a nonprofit to try to help young men avoid gun violence. And you could see she was very traumatized still from the experience. But by the time we had finished that session, she had opened up enough to start talking. And we finished the session because we asked, what is different today for you as a result of having talked? And one of the thing that she said that really stays with me, she said, I think I'm going to try to take on the job that my brother had been doing to try to end gun violence through his nonprofit. She was still very young, in her early teens, but you could see that something sparked her and gave her the life to say, I'm going to continue forward. And these are all very tough situations. This is a girl who lives with a family who doesn't have many resources, saw something very traumatic. I think if we just reach people, we help them, because most people have the power to really fuel themselves forward. We just got to let them know that. And that's what mental health support really is giving people a chance to fix themselves inside with some good professional help. That's what we want to try to do, because we know a lot of Americans are hurting, but they're also willing to reach out and trust us. Well, thanks for sharing. That's a powerful story. Secretary Becerra, thanks for joining us. Really appreciate it. Such an important issue. Thanks, Bob.
Welcome Bob Cusack, Editor-in-Chief to The Hill, to the stage, who will introduce our panel discussion.
Good morning, everyone. I see everyone has their coffee. There's a lot of murmur when we started, and usually people are pretty asleep. We've got an exciting panel. I want to introduce them now. Our panel will hear from advocates and local leaders leading the charge on 988, representing the organizations on the front lines. First, I want to introduce Hannah Wesolowski, is the Chief Advocacy Officer at the National Alliance on Mental Illness. In the interest of transparency, please note that NAMI is the sponsor of today's program, but this panel is editorial in nature, and we felt it was important to include her voice on the panel. Adrian Bridenstine is the Vice President of Policy and Communications for Baltimore's Behavioral Health System. And Laurel Stein is the Executive Vice President and Chief Policy Officer of the American Foundation for Suicide Prevention. Thank you for joining us. I first want to talk by remembering what number you called before 988, okay? Anyone remember what it was? Well, you could call 911, that's true. However, but the suicide, that's a good answer, actually, which is always good to call. But it was 1-800-273-8255. Now, to be fair, the last four is TALK. So it's 1-800-273-TALK. But in an emergency situation, who's going to remember that? I've been covering government since 1995. I honestly think this is one of the best things government's ever done. It's very simple, and it should have been done a long time ago. I want to go down the panel, and Hannah, start with you, and just describe in a couple minutes your group's mission and your personal connection to mental health.
Yeah, well, thank you for having me on the panel. So NAMI, for those of you who don't know, and hopefully most of you do, we are a nationwide alliance, the largest grassroots mental health organization, and we have over 650 affiliates across the country. Our mission is to provide support, awareness, education, and advocacy so that all people with mental illness can build better lives. We have families and peers as part of our network, and it's really about building a community that cares. And we've been really focused on 988 because for so long, people in crisis haven't gotten the help that they've needed. Instead, they are incarcerated, they are hospitalized, they cycle in and out of homelessness, or sometimes worse, they lose their lives. And we hear those stories every day at NAMI, so 988 is such an amazing opportunity for us. My family, as I'm sure most of you, is not unimpacted by mental illness. I have several close relatives who have mental health conditions, and it's so important that every single one of us has the resources we need when we need it. I have nieces and nephews who COVID was really formative for them, and they've been struggling. They've been struggling, and I want them to get the help that they need if they ever feel like they need it. So it's an honor to work on this issue and on this mission, and just delighted to be with my colleagues today.
Thank you. Good morning, everyone. I'm Adrienne Bridenstine. I'm with Behavioral Health System Baltimore. Behavioral Health System Baltimore is a nonprofit organization, and we serve as the local behavioral health authority for Baltimore City. So what that means is that we're responsible for overseeing that full system of care for mental health and substance use services. We do not do direct service. We fund services, we monitor programs and oversee programs. For crisis services, we fund around $15 million in crisis services for the Central Maryland region annually. Part of our role is to promote access to that system of care, and that's where 988 is critical. We used to use the old 1-800 number. The now new 3-digit, easy-to-remember number is the number that we use to promote access to that broader system of care. For me, in terms of a personal connection, just like Hannah said, my family's not unimpacted by mental illness. I had an aunt who suffered from mental illness and substance use. But for me personally, one of the biggest drivers for me now is my 5-year-old son, 5.5. I'm sorry, he would correct me right now, 5.5. That's the future generation. He already knows what 988 is, by the way. He's a COVID child. He sat through so many conference calls. He already knows what it is. But they're our future, and they can take 988 and help to transform the system. I want him and his friends to know that this is where you can call if you can't talk to mom or dad, which I know is coming when he will eventually hold me in contempt and not like me anymore. But that's one of the things that for me personally is one of the biggest drivers.
Thank you. Good afternoon. First of all, I want to thank the Hill and NAMI for bringing us all together today in person and virtually on this milestone occasion for the 1-year anniversary of 988. As Bob said, I'm Laurel Stein. I'm the Executive Vice President and Chief Policy Officer at the American Foundation for Suicide Prevention. We're the leading nonprofit organization dedicated to saving lives and bringing hope to those affected by suicide, including individuals who've experienced a loss. We carry out our mission through being the leading private funder of scientific research, as well as community programming, public education, and advocacy. And we do so through our chapters. We have chapters in every state 74 nationwide, including DC and Puerto Rico. We're headquartered in New York. I head up the DC Public Policy Office. And we know that connecting individuals who are experiencing mental health, substance use, and a suicide crisis need to be connected to care and to services, and far too many have been left untreated. We know that upwards of 90% of individuals who died by suicide had a diagnosed mental health condition, often left untreated. And so we, through our networks and our community partners and all, are here to amplify and to build out 988, not only as a number, but also for that continuum of crisis care. I have been a mental health advocate for quite a long time. I see so many friends here. I've worked in many different jobs. I don't want to get emotional, but my husband is struggling with serious thoughts of suicide following cancer treatment, and so we're dealing with that.
It's a very emotional moment, and everyone does know somebody, and some are very close to us. I'm sorry to hear that, and I hope he does well. I'm going to start. I do want to go down the line, and Laurel, I'll start with you just on the success of 988, but also what needs to be done from this point on. We're only 1 year in.
Yes, and we need to applaud ourselves, right? And applaud the administration, applaud SAMHSA, the president, and ourselves. We need to pat each other on the back, because in the year that 988 has transitioned, as Bob was saying, it had that long 10-digit number. Thankfully, it had talk on the end, so you can at least remember the talk, 273 talk. But 988 is now in parity with the 911 number that we all, most of us in the room, grew up learning and knowing to push that really quickly. We know that we've had unprecedented federal investments in 988. From fiscal year 22, the Lifeline was at about $102 million. And in fiscal year 23, went up to over $500 million. And that's not even including all the money that was included in the Bipartisan Safer Communities Act, the $150 million, money from the American Rescue Plan, et cetera. And yet we do know that we're just at the beginning. We're just at the beginning. And while we're on that path to progress, there's a lot more needs to be done. And we need to recognize that a mental health response, and I credit NAMI to this, deserves a mental health crisis deserves a mental health response. We know this, but there's so much more to be done really to transform our crisis system into one that is equitable, as Secretary Becerra said, so it's supportive, it's appropriate, and it's accessible to all individuals, no matter what age you are, where you live, and that's particularly relevant to individuals who have been historically marginalized, underserved, Black and brown communities, Alaska Native and American Indians, LGBTQ, as well as individuals with disabilities who I think are often overlooked.
Adrian, what about you? And as I understand, the Baltimore's behavioral health system takes in calls from 988. So can you tell us a little bit about that as well as your assessment of 988?
Yeah, I mean, so what we do is we oversee that system of care, and we have a regional 988 helpline that serves the Central Maryland region. One of the things that we actually did is we did just regionalize our helpline. In Central Maryland, we used to have 3 independently operating 988 helplines. We brought them together all under one roof. And the reason for this is because we recognize we're going to be able to better serve the community that way. People cross these geographic boundaries, so why wouldn't we operate in a regional way? And it's helped us to maximize our workforce, which, as we all know, has been a challenge for not just the behavioral health field, but across the healthcare sector. We've also been able to improve the timeliness of our response. Our 988 helpline, the regional helpline, answers calls within 10 seconds. That's fantastic. We want to keep that up. We've been able to use some of these federal and state resources to staff up to get ready for, when the launch happened a year ago, to staff up and get ready, but we've continued to hire call takers so that we can be as responsive as possible. Ultimately, though, we know we need to be responding to the community, and part of what we need to do ahead, and I think Laurel alluded to this, is continue with that culture change. We know for way too long Our communities have been conditioned to call 911, as you mentioned earlier, for emergency response because we didn't remember that 1-800 number. We've got to work with community to help make that culture change so that they're not only aware that the 988 helpline is there, but that they trust it.
Yes.
And we have a lot of work to do ahead of that. One of the things that we did locally leading up to the launch of 988 a year ago is we did extensive community engagement and outreach to hear exactly from the community what they wanted from us in terms of how we talked about 988 and how they wanted it to operate and be responsive to their needs. One of the feedback that we got from someone in Howard County was that they thought this was amazing. 988 invited a lot of hope for this person, de-escalation, trauma-informed care, but she wanted us to put it into action. Make her believe it, is what she said to us. And we have to deliver on that. We need to make sure that this is a resource people trust and can feel that they can rely upon. So we have a lot of work to do ahead of that, nationally and locally, but I think we've got some strong footing and we're moving in that direction.
Anna, your thoughts?
It's been so exciting to see how not just the administration, but states have stepped up to build out crisis services. I mean, answer rates are through the roof compared to what they were, with demand up a significant amount. I think, roughly 40% year-over-year increase between what was that 10-digit number and 988 now. But we know that it's not just a number that we need. We need these crisis services. We need to have a full continuum so everyone has not just someone to talk to, but someone to respond in a safe place to go. And we're seeing pockets of that across the country where these services are being built up. I think one of our challenges in awareness is until that's consistent across the country, it's going to be hard to tell people what to expect when they contact 988. For some people, the only in-person response that might be available might be police or EMS. It might not be a mobile crisis team made up of behavioral health responders. Everyone deserves a true mental health response, and I think that's the challenge that we have moving forward is our work's not done. There's a lot more work that needs to happen in communities across the country. So no matter where you live, who you are, what community you come from, you have an expectation of what type of response you can receive. That being said, to see how much bipartisanship and collaboration across groups has happened, and collaboration federal and state level is truly remarkable, and the speed. I mean, 3 years ago, 988 didn't exist. It was a thought on the horizon that we might have this 3-digit number. And here we are, just a few short years later with this resource that more than 4 million people have contacted since July. I mean, that's incredible. But not that many people know about it. Fewer than 1 in 5 people know that this exists and that it's a resource for them. I think that's going to be the real challenge going forward is making it ubiquitous. So, my 3-year-old, your 5-year-old, everyone in this room and everyone we know realizes that this is a resource for them.
I wanted to talk about awareness, and we are going to open this to questions. I know we have a lot of great stakeholders in the room. Got about 10 minutes left, so think about your questions, and we have staff with microphones. But you all talked about awareness. What works here? Is it an ad campaign? I think it's 13% of people know about 988, obviously, in the beginning, and I do think it's remarkable because you had different agencies involved. I talked to the former FCC commissioner at a prior event on this. You had states involved in a polarizing environment that this came together so quickly. A lot of pieces of legislation take a decade plus to get done. But what works in getting people, in educating people on 988? Anyone?
Building trust, I would say. I mean, building trust and communicating clear to people what they can expect. A lot of times, we won't act, this is universal, people won't do something because they're just afraid of it, or they're afraid of the unknown, right? One of the things that we learned through our community engagement and market research that we did leading up to the launch of 988 is that people did not, the word crisis did not resonate with people. They did not want us to call it a crisis line. They didn't know what we meant. And really all they wanted was help. So, and we heard that across populations. We also even heard it from youth. We just finished wrapping up some youth market research. Nobody likes that word crisis. It actually is a bit of a turnoff. So for us, what we did locally, and it helped us as we were building off of past campaigns, is we call it a helpline. It is what you can call for any type of help. You don't have to be in distress. You could just have a bad day. And our helpline operators are here to help you, get you connected to resources, or just talk to you. And that has been particularly helpful for us in helping to raise awareness. And we use that throughout all of our awareness campaigns. We do digital marketing. We do all kinds of marketing. And then the other thing that I think is particularly helpful is working directly with community. One of the things we're particularly proud of that we've done in Central Maryland is we've launched a 988 Ambassadors program. And we've got the team over here who helped us launch it. So if you want to talk to them, they can tell you more details. But what it is we're working directly with trusted leaders in community across Central Maryland. So that could be faith leaders, community association members, your PTA leader. And we worked with them and provide them with our 988 campaign resources, but help them understand how it works, have them have direct experience calling the line so that they can communicate within their networks. Because it's a snowball effect, and it's gonna take years for us to support that culture change that we need. It's gonna take us 10, 20 years to get people to realize I don't have to call 911 or go to the emergency department for care. I can call 988 and I can trust it and have a reliably and safe experience.
Yeah, I'm so glad that you mentioned trust and involving community partners. We know far too often historically marginalized and underserved populations were met with tragedy often and met with trauma when they called 911. And now that 988 is here, it should be an alternative to 911, but it should be an effective alternative, accessible, supportive. I'm really proud that we have bipartisan members in Congress. Give a shout out to Congressman Cardenas, who is leading the 988 task force, crisis task force. It's a new task force, I think enacted last year. We didn't have a 988 crisis task force before. Legislation that he had introduced last year, and hopefully soon this year, the 988 Implementation Act calls for a public awareness campaign targeted also with 988. But it takes each and one of us. SAMHSA is doing a lot of the work as well. There's shareables, there's lots of resources out there. AFSP, NAMI, others, many are doing this. It takes each one of us really to spread the word, but we also need to ensure that communities are part of the fabric of the development and build out of 988.
Yeah, one of the things we've really pushed is that there are advisory bodies in every state and ideally every community that represent the community. This needs to be a system that works for all of us. So, making sure everyone has a seat at the table, from law enforcement to mental health providers and crisis responders to advocates and families who are impacted by our system, and diverse representation as well. We can't pretend that our current system impacts everyone equally. Having a police response does have an equitable impact on individuals. And so making sure that folks are at the table to build these systems, not just 988, but the crisis services, is important. NAMI just released a poll, and we found that the vast majority of people believe that if you dial 988, you get an in-person response. And I think educating people about what to expect and how it's kind of like 911, but it's also very different. 80 to 90% plus of people who contact 988 are going to be de-escalated over the phone and ideally connected to local resources. So we're reducing the need for an in-person response altogether, and I think that education component is going to be important. But I completely agree, we need those trusted messengers. And one point that often gets lost is there has not been appropriations for an awareness campaign. Yes. Mm-hmm. So, we can't be surprised that awareness is low when we haven't really invested in that wide-scale research and promotion.
And we're not talking about billions of dollars here, right?
No.
No, I mean, I think anything at this point would be valuable, but you look at a lot of, smoking cessation campaigns, we're looking at $50 to $100 million to save lives, like save lives. Mm-hmm. I mean, it could have such an impact.
Let's open up for questions. If you have a question, please raise your hand. If you can identify yourself and keep the question to a short amount of time, not like C-SPAN.
My name is Rebecca. I am with Miller & Holt lobbying firm, and I currently go to George Washington University. My question is, I know that mental health affect college students. It affects their academic performance. So my question is, how are you working and will you work with universities to help inform them and promote 988 in our college campuses? Thank you.
Yeah, I mean, I think that's a fantastic question. One thing we did find in our polling is that, young adults, 18 to 29, were more aware of 988 than others, but still far too low. I know NAMI has a campus program, other groups in the room have campus programs, and I think it's important for all of us to make sure that we're working with those groups to share this messaging. Again, a college student doesn't want to hear from me about 988. They don't have a shared experience with me. They want to hear from their peers. And it's really important that we, again, leverage those messengers to have that peer-to-peer communication. And it's going to be really important to spread that. And also work with campus, healthcare providers, and counselors and administrators to make sure they're aware of it. I think that's our challenge, both in K through 12 and in college, is we need to, the people who are in contact with the person in crisis need to also be aware of this. It's a resource for them, and it's also a resource that they can refer people to.
Yes. And just to chime in on that, we know that, it's the second leading cause of death, suicide for 10 to 34-year-olds. And the CDC, with their youth risk IRBS survey, youth risk survey, youth behavior survey risk, whatever, that 1 in 10 high school students even in 2021 were contemplating suicide. Actually 1 in 5 were contemplating suicide, and 1 in 10 actually attempted suicide 1 or more times. So we recognize that this is not only an overall crisis. We have suicide is the 11th leading cause of death, but particularly for youth and young adults who are in college. And just as Hannah was saying, there are many organizations, including AFSP and others, NAMI, who are involved in the community as well as in the college setting. So appreciate your question.
And if I can just note, one of the great things of the last year, there was a pilot that is now permanent for 988 for LGBTQ plus youth and young adults up to age 25 to have specialized resources. And we know suicide rates in the LGBTQ plus community far exceed the rest of the population. And so figuring out how we can make sure folks are aware of that specialized resource. So again, talking to peers, somebody with a shared experience, I think that can have an enormous impact.
And I'll just chime in, this seems like the great place to mention that you can also text and chat 988. Yes. You don't have to always call. Yes. One of the things that
That's a great point.
Yes, for when we're talking
my
about
kids
youth,
don't pick up the phone.
College,
So
text and chat. No, but one of the things, we just wrapped up some market research regionally, again in Central Maryland for youth, and we found 2 really interesting things. One, validated what assumption we had, is that youth and young adults do prefer to text and chat to get in touch with 988 for help. So we need to make sure that infrastructure is there to be able to respond to them. We know we can answer calls in 10 seconds, but can we respond to texts and chats that quickly? We're not quite there yet. But the other interesting thing that we learned, which was a little rubbed against some of our assumptions, is that youth actually do want to speak to adults. They do want to know that they're getting in touch with 988 and speaking to an adult. They very often want to go to their colleagues and their peers for some things, but when they want some help and they're in distress, they had felt a lot of feelings of relief knowing that they were talking to a professional and that were an adult on the line.
And that's especially important because of the mental toll that COVID took, and that's going to affect generations, right? I mean, my daughter didn't really have a prom or a graduation, and that's tough on kids. And that's what kind of challenge does that present going forward over the next decade or 2?
We have to be mindful that even before COVID, the United States was experiencing unprecedented levels of crisis. Yep. And the mental health system was not meant for these challenges. We have numerous counties that have mental health shortage areas. So we have a provider workforce shortage as well. So moving forward, 988, as we've said, is not just a number, but it's that opportunity, this historic opportunity to really build out and transform the system that meets all the needs of individuals who are experiencing mental health and suicide and substance use crisis.
Time for another question, if there's one in the back.
Hi, my name is Andrea Wagner. I'm back here.
Yeah.
I'm the director for the California Association of Mental Health peer-run organizations. And, we've been talking a lot in our state about implementation of 988, but I'm also a mother of a teenager with mental health challenges and a sister to people with substance use and mental health diagnoses. And I was really excited about 988, I still am. I guess my question is, how can we build up the link between 988 and peer-run services and peer support? And how can we get more people that are answering the phone that have their own personal lived experience with mental health?
I think that's a fantastic question. Thank you for sharing a little bit of your own personal perspective. I completely agree that we need to lift up and elevate people with lived experience. They are what help to make the connection. We have a lot of call takers at our helpline that do have lived experience. So that's, I think, an asset to our helpline. One of the other shifts that we're also supporting across the system is with our mobile response team. So that's the team that will come out and respond in person. We're looking to hire peers and have peers be part of that team as well. So, and I think we can embed peers and people with lived experience across the entire system of care. It doesn't have to just be within the crisis continuum. But I also think we can look at what we might think of as non-traditional resources like peer respite. That's another asset that we can be looking at. And what that is a place for people to go. It's not a clinically driven model. It's a respite program that is run by peers. It is for where people can go and stay for up to 10 days, stabilize, and do it without that kind of clinical care that you might get at a crisis stabilization center, for example. So I think there are to answer your question, I think there's a lot we can be doing to make a stronger connection between the peer and lift up peers within our system of care.
As well as make sure that peer support providers are reimbursed and we have sustainable sources of funding for workforce.
Maybe one more. Who's ever closest to the mic? You pick, Casey.
Hi, my name is Filiz Odabas-Geldia. I am the Executive Director of International Association for Human Values. First of all, I'm sorry about your husband. Are you considering breath-based tools and techniques to deal with mental health issues? I work for this organization. We offer something called the Sky Breath meditation. It's been researched by Yale, Harvard, among many other institutions, and found to be effective for veterans suffering from PTSD as well as students. And I know that it's almost mainstream nowadays to look at these kind of interventions, but I think the important thing is, will there be funding for it, serious funding? Because breath is something we carry with us. It has no side effects. It's free of charge. People can learn easily. And I wanted to find out if there's any studies on that one. And I just want to plug in. We are organizing an event, World Culture Festival. More than 100,000 people registered at the National Park, partly to create awareness about these tools and techniques. Thank you.
Yeah, I'm not aware of any research about it. It's not something I'm as familiar with as an intervention tool, but would love to learn more from you after.
Yes, I'm unable to answer your question, but I encourage you to reach out to AFSP, advocacy@afsp.org, and we can try to help you. Thank you.
We have run out of time. I want to thank our panelists, and also we have a short video from our sponsor, the National Alliance on Mental Illness, featuring the Mental Health Crisis Response Team. Please thank our panel. Thanks so much.
It's a scary process because you're still going through, right? Whether it be paranoia, which was for myself, and voices, you're still hearing all of that stuff. It's still dealing with the crisis that had me there. I just wish that I had people still seeing me as a person, and not as schizophrenia, or not as crazy, or as a criminal.
we decided to call 911. I clearly expressed that this was a mental illness crisis. So when they arrived, of course, my loved one was not compliant, and they treated him as if it was a domestic violence offense. And we watched our loved one thrown to the ground, put handcuffs. It was heart-wrenching to watch.
As a 911 dispatcher, when these calls, these mental health crises calls for help came in, all I basically had at my disposal was whatever officer was available at that time, or I could send an ambulance, maybe a fire truck. But as a person who's been in a crisis, you know, if I see all these different vehicles rolling up, it's not gonna help. It's gonna make things worse. The fact that 988 is coming online and becoming available is unbelievably just phenomenal for me. They can send the right people. You know, you can send a clinician to the scene if that program is being offered in your area. You can connect them up with a local hospital or doctors or things like that, because you're calling the right people to get help.
If we receive the proper help at the proper time, then people who live with mental illness can avoid the unnecessary trauma of being in the criminal justice system.
There's a poem. It says, our deepest fear is not that we're inadequate. Our deepest fear is that we are powerful beyond measure. It's getting me a little emotional thinking about it, but it says, it's not in some of us, it's in all of us. And I think that that's the truth with recovery, is that it's available to all of us, not just some of us, you know, as long as we're willing to put the work in for it.
Now please welcome back to the stage Bob Cusack and Washington State Representative Tina Orwell.
Tina, thanks for joining us. Tell us about your experience in Washington State with 988.
Well, it's been an exciting year. I'm really proud of the work our state's doing. It's been an incredible team effort. And we were pretty early on kind of jumping into 988, and it was really helpful, all the work with SAMHSA and the draft legislation. And so we passed our first bill a couple years ago, and I think we're one of 5 states that include the fee. And that fee brought in about $50 million a year, and we were able to use that funding to double and sometimes triple the staffing in our 3 call centers. And what we found is it's been extraordinary. I mean, we had a 50% increase of calls, and our response time went from 50% to 95%. So it's been pretty dramatic. We also were able to start up a 988 tribal line called Native and Strong. It's the first in the country, and it's a beautiful partnership with the tribes and one of our call centers. And so that got up and running as well. We also have a next day appointments, and I really bring that out because it's really important. We know most of the calls are resolved on the phone, but for those that don't, it's really important that they get care right away. And this is a requirement not only on the Medicaid side, but our private insurance. So a lot of people have insurance and they have trouble accessing care. And so again, you know, if you're suicidal and you know you're able to kind of stay in your home, you need to be seen by someone right away. And so it doesn't necessarily have to be your primary care provider, but it needs to be someone trained in mental health. So I'm really proud of those components. And this year, we had some next steps, which were really brought by the community. We were told, you know, if you're going to have an alternative to the police, you need to be able to have a rapid clinical response. And so a lot of what we worked on this session is really to be able to get teams out there more rapidly, and that they're non-law enforcement whenever possible. So I'm really proud. I think we have some good steps. We're learning along the way, like everybody else.
Can you tell us of any kind of success stories that have changed lives because of 988?
The stories really touch my heart. And there is a gentleman, Danny, who's in the neighboring community, and he shared his story. He had been texting with one of our call centers, and he had been overwhelmed. He had lost his mom. He had this huge life change, and it was really escalating for him, thinking about suicide. And so he, over several days, he was in the chat room with 988, and one day he took his car and he was on a railroad track. And he thought about all the messages the staff had sent him that gave him hope. And he saw the train coming, and he started his car and he took it off the track. And he was able to get help. And so he shared his story, and this is why we do this work, right, is to save lives.
What do you think policymakers need to do from here, whether it's state level, federal?
Well, I think it's really important, and again, I want to really recognize all the federal partners and NAMI, and I think our federal partners have given us a path forward, and this is a once-in-a-lifetime opportunity. I'm a mental health professional. I worked 20 years in mental health, and I have never seen this opportunity. But we need each state to really come up with their plan. It's really important that they involve in the planning and implementation people with lived experience. I mean, because our systems have failed so many people. We often traumatize people in crisis. People are sent to jail. They're sent to emergency departments and strapped in gurneys. And I know it's going to take time and trust, but I think they know what the path is. How do we create a system that's trauma-informed, that's healing, that's culturally sensitive? And that's going to take all of us coming together to figure that out. And so I think at the state level, we can give the resources and kind of design the system from the big level.
What about underserved populations? You mentioned tribes, and we've done a fair amount of reporting on tribes who, in many ways, are kind of forgotten, and they have major problems, with mental illness. Can you talk about that a little bit?
No, it's really important, and we had really good testimony when we had our 988 bill, and Vicki Lowe, who's one of our leaders in Washington State, she serves on the Indian Health Commission. She had shared her story and loss. And so I was really proud when we started looking at investments. The first investment with the fee was the tribal line. And they do have the highest rate of suicide. And so it's really important at the state level, we plan and invest in diversity and strategies up front. And again, even when we did our rapid response clinical, 30% of the funds will go to the tribes. And so again, I think that's really important that we think about those things up front when we're designing a system.
What do you think about the stigma? Because years ago, I'm not saying this doesn't exist now, but there was this mentality from people who didn't understand, friends or family members, kind of get over it, what's wrong with you? To some extent, I do think, as I said with my interview with Xavier Becerra, was, hey, people do recognize it more. Yes. Can you talk about that a little bit? And at least that's been some progress where I think more people, including some of my family members, are able to talk about it.
I think that's such an important point. And, I was touched by mental health as a kid. My father, who was my foundation, hardest working man I ever knew, he was a World War II veteran, and there's two things he never talked about. He never talked about his experience in the war, and he never talked about his father. And years later, I learned his father had taken his life by suicide, my grandfather. And so sometimes we learn early on that we don't talk about these things. They're painful, there's trauma there, but it's healing. And I think one thing with COVID is you say, how are you? And people say, fine. No one says fine anymore. They're like, I'm stressed, I'm overwhelmed. It's hard, life is hard.
Right, that's true.
So I think we're in a new time. And one of the things, I meet with a lot of youth, and this is really important to me, and they have been hit so hard by COVID. And the messages that youth have given me is, one, can you help adults be comfortable talking about suicide? They also tell me, can we have more mental health in the schools? And I do think as we're designing 988, we need to figure out those connections to our schools.
If you had a magic wand, what's the biggest obstacle that you would attack to help people and save more lives?
Wow, I have a long list.
Okay,
but
you can give me top 3 if you want.
Well, first we have to give ourselves grace. I keep hearing the reference to 911, which I think is really important, but a lot of us grew up where we had cards on our fridge with phone numbers, right, before 911, right? Most of them weren't filled out. There was like the FBI, like we're going to report a white-collar crime. Don't know why that was on there. But, you know, it took 20 or 30 years to really, you know, bring 911 up and running. And so we've done a lot in a short amount of time. So first I'd say, you know, give yourself grace. Change is hard. But I also would say that it's the stories that make a difference. As a legislator, I can introduce the most perfect bill, but if it's not the stories of the why, it's going nowhere. And so one of the things that happened during COVID is we were remote. And we had, the 988 bill had 160 people sign in support. And that was just, so, you know, it was saying this is so important. And so I do think as we're engaging the community, we need to have all the voices at the table helping to shape the way, and that's what's going to get us through these things. And we can't be too hard on ourselves. We can't fix the whole system at once. I heard so many people to say, well, you know, maybe we just start here. 988 is the catalyst. That is a step forward that is going to help us, I think, create a better system overall.
You mentioned the community. What about, what changes, hopefully you've seen some, in the business community on mental health?
Well, you know, it's interesting because I do talk a lot at chambers and at Rotary, and I think they're really open to these presentations. Again, I think it affects their families, it affects their employees, you know, so I think the business community does want to be part of the answer, and I think they can be part of raising the awareness, because I do think they're connecting with a lot of people in the community who, again, there were small business owners that were so impacted by COVID, right? Very difficult times. I do a lot on foreclosure prevention. A lot of people lost their homes. So again, I think they were touched. They know this is an important issue, and they really could be one of our allies.
Has Washington State learned from other programs or other states?
Yes, well, one, there's a 988 Jam. If you've not listened to it, you should listen to it. It's incredible because they look at best practices all over the country. We got inspired in our state, and we took a team to Arizona who is doing incredible work. And we had a missing component in our state, which the crisis relief centers. And so Senator Dinger I work with did a bill on that this year. We need those no-rung doors. We need those alternatives to emergency department and jails. And so it was really helpful to see Arizona. We've connected with Georgia, Colorado, where I used to live. So I feel like we're all learning from each other, which is so part of the process. We compete with Oregon, but I'm sure they're doing good stuff. But, you know, we learn from each other.
You mentioned younger generation, and you mentioned your father. We talked earlier before about how the younger generation does want to talk to people, even though they've gone through a very difficult time, but they're more open to it. Have you seen with the older population that it's a little more difficult?
You know, it's so interesting because I think there's maybe a gap in asking for help.
Right.
And of course, I work with a lot of veterans. That's one of my priorities. And I do think the engagement with the veteran population, especially older veteran population, is going to be really important. And I did see the other day a veteran, we were doing this great event, and he gave me one of his friendship coins, and it had the old number and it had 988 on it, right? So we need their help getting that message out. And again, you know, I think there's a lot of stigma there, and I think, you know, hopefully we can help break that down.
When you go around and you're speaking of stories, when you're talking to veterans, you know, depending on what statistics you look at, but I've heard there can be 22 suicides a day from the military community. How has that affected them?
It's huge. And, you know, one of the things we did with the 988 is we created a 988 emblem, and the proceeds go to veteran suicide groups. And what we found is the peer-to-peer is very effective for veterans. And there was a veteran that shared his story that he had called 988, and he'd lost his wife to cancer, he had PTSD, and he had seen something that said 988 on it. And he called and he said, the woman answered, and she had this soft, kind voice, and she told me everything I needed to hear. And she'll never know that she saved my life, but she did. And so I do think with the veterans, it's really important who the messenger is, right? So we need to make sure that we're partnering with a lot of the veteran organizations to really get that word out in a way that's meaningful to them. And it is a huge risk population, absolutely.
Is there anything that I didn't ask that you would want to say that maybe I didn't trigger?
Well, one of the things that we're doing in our state, I'm sure it's happening in other states, is we're partnering with 911. And so part of the legislation is we're co-locating some of our 988 staff at 911 centers. And I sat in one the other day, a 911 center. They have very difficult jobs. Their dispatch are like 120 seconds, right? And our 988 is more of a clinical intervention. And so we're hoping by co-locating some of the 988 staff that they will transfer more of the calls to 988, that they'll get more comfortable. The day I sat in, I'd say 1 out of 4 calls were mental health calls.
1 out of 4?
1 out of 4, and 1 was an active suicide that just needed the police to get out there. But the other 3 could have been a 988 intervention. So again, I think we're trying to figure out those partnerships that can be effective. And again, it's going to take time for people to know 988, so we do want to work with 911, and they're important players. And so the other thing we're doing is a lot of training. And I just think that's especially important. Like, Washington State has a very rural area, and our highest rate of suicide is in the agriculture community. And so we have to understand, like, rural Washington, how do we reach out to agriculture communities? You know, and I think 988 is doing so good on LGBTQ, and we got the Spanish-speaking line. I think the more we can do to tailor 988 and the responses in the community, the better.
Right, because this affects urban, rural, and sometimes the rural community is not thought of as well.
Absolutely.
Okay.
Very important.
Well, thank you for traveling so far, and I'm sure that your story is very powerful. Please thank Tina for joining us today. And I'll give that to Sarah. Thank you so much.
Now it is time for our sponsor perspective portion of our program. Please welcome Paul Pazan, retired Chief of Police at the Denver Police Department, for a personal story. Thank you, Paul.
Thank you very much for allowing me to be here in the first place. I also want to thank The Hill, an organization that I am passionate about, NAMI, both the national organization and our local affiliate in Denver. I want to thank each of you for being here, as well as those that are joining via live stream. You know, we know that we need to start with why, and I'm going to start with why. I'm going to talk a little bit about the how, and then I'm going to end with why. But why we're here: mental health is real, and finally people are starting to get that. How I got here in front of you is, you know, law enforcement is seeing a lot of these calls for service, and in Denver, we really leaned into this issue, working with NAMI. Every single officer in Denver is CIT trained, crisis intervention techniques. We could have easily rested on our laurels and said, hey, this is how we respond to mental health calls and everything is fine. But we realized that wasn't enough, that there are outcomes for individuals in crisis that have been negative for the individual, negative for families, and we need to figure out how to do better. So rewinding the clock a little bit, Denver was early adopters of what's called a co-responder program. This is where you pair a mental health professional and a police officer together to address high acuity, violent calls for service, or calls for service where an individual is armed with a weapon but is in crisis. We saw immediate success with that, and co-responders are a program that many departments, many cities, many municipalities, counties across the country have adopted. That's great, but what about low-level calls for service, and calls for service where that uniform can actually escalate the situation? In Denver, I'm very proud of our efforts that we were working on a community-based response dating back to May 5th of 2014. almost 10 years ago, listening to our community at one neighborhood in particular that had very high rates of mental health challenges, highest in the state, as well as significant issues with poverty and inequity. So what we did is figured out how can we change this paradigm. This was some of the precursors to something that is widely known now as the Denver STAR program, Support Team Assisted Response. This is now mental health professional with a paramedicine professional, no police officer whatsoever, to address the nonviolent, the individuals that are in crisis that aren't armed with a weapon, and help people. Again, great success. We launched that program June 1 of 2020. A lot going on June 1 of 2020, but there was about 2.5 years of prep work in order for us to get that going. 30 days later, we launched the third part of what we call the continuum of crisis care. So this is where we have outreach case coordinators or social workers that then do the follow-up. So if Paul is in crisis and I'm violent or armed with a weapon, that's a co-responder call. We respond to that situation, we de-escalate it, get Paul the help that he needs, and high fives, everything is great. If Paul is unarmed, nonviolent, that is a STAR team call. De-escalate, get Paul the help that they need. But what happens next week, what happens next month, and that's what the Outreach Case Coordinator program is, to do that long-term sustainable help for an individual to get them the help that they need, the support that they need. That way 911, 988 isn't responding to Paul's needs every other week. Very proud of those efforts, and we continue to build that. We have something called the Assessment Intake Diversion Center that helps divert folks out of the criminal justice system very early on the process with absolutely no criminal case whatsoever. All of that is great. Very, very proud of our efforts in leaning forward to address this challenge that we have, the challenge of our lifetime in our community. Now, that's a little bit of the how, but the why. 16 months ago, as the police chief in Denver, I had to call 911 for a child who had his first mental health break. But this occurred 1,000 miles away in a city, very progressive city, that I assumed we could get the help that they need. I'm a person of means. I have that police chief's cell phone programmed in my cell phone. I know how to talk to the officer as they're responding to the call for service, and I did that. I spoke to the officer before making contact with my child, who was in as bad of a break as you could ever imagine. And I asked, do you all have co-responders? Do you have a mental health professional that can help my child? And to my dismay, the officer said, co-responder? What do you mean? I said, a mental health professional that rides with the officer to help de-escalate the situation. And the officer told me, if I had one of those, I'd throw him out of the car. I'm like, this is great. This is the person who's going to go talk to my child, first break, never had any type of mental health challenge like this before. It took 3 days, 3 separate times of trying to get my child the help that they need. And finally, that occurred, and we're in a much better position today, a much better place today, so I'm very thankful for this. But the timeline, 16 months ago, that was before 988 existed. And so I could not be more thankful that the Hill, NAMI, that all of you are here today, because we need to get 988 out there in our lexicon. It needs to be as widely known as 911. It needs to be as widely known as what's the 411, and this is how we can help get people the help that they need. Now, all of this is important. It's critical that we get the awareness built up around 988, and we also have to look at models, as many of the speakers have talked about here before, of building up these structures, building up those responses that can help individuals in crisis. Our North Star for everybody in this room, everybody that's watching, for all of our communities, is better outcomes for individuals in crisis. That should be nonpartisan. It's not a political party. If it can affect me, it can affect anybody in this room. And that is why we have to continue to work towards these goals to help individuals get the assistance that they need to get the right response for the right call. We've made a lot of progress, and 1 year is a lot to celebrate. There's a lot of progress that has been made. There's a lot more to go, and I'm thankful that both the Hill, NAMI, and all of you in this room are helping to get that message out there. One last little bit of personal privilege I would love to just share. Please also support your NAMI chapters. Right, I told you that my personal situation is much better than where it was 16 months ago, a year ago. But that long-term support that the individual in crisis needs, so do families. And I was sideways a year ago. I had no clue what I or my family was going to do in this situation. And fortunately, the president of our local chapter and I had a conversation. His story was remarkably similar to my story. He just experienced it 10 years in advance. So somebody that you can lean on, somebody that families can lean on, because this does not only impact an individual with a diagnosis or an individual that is dealing with this lifelong health issue. It also impacts families. So please continue to support NAMI, the great work that they do. Tell your friends, tell your neighbors, tell anybody that you know. 988 is a great tool. We need to elevate this number to help us get those better outcomes for individuals in crisis. Thank you very much for your time.
Thank you again to Paul Pazin and to the National Alliance on Mental Health for its support of today's event. And now for our final speaker today, I'd like to welcome Senator Cortez Masto, a Democrat from Nevada. She sits on the influential Senate Finance Committee and helped to implement and fund 988. She also introduced, which we'll talk about, the Behavioral Health Crisis Services Expansion Act. Senator, thanks for joining us.
Thank you.
Tell us about your experience on the Finance Committee and 988 and the value of it, and what do you think could be improved, and maybe a little bit on your legislation.
Yeah, so first of all, thank you for this conversation. It is so important. And let me just say for folks, on Senate Finance, there's bipartisan work being done to address our mental health needs in this country. That's a good thing, right? Senator John Cornyn and I are co-chairs of a subcommittee. We've broken down into different subcommittees, and it's great to have that partnership. And that's always been the case. But let me kind of jump back. I'm a law enforcement background, so I was Attorney General for Nevada. What I saw in Nevada was this idea that we needed to bridge the gap between law enforcement and healthcare, because quite often we were seeing law enforcement were the first responders for somebody who's in acute mental health crisis, and we're just not prepared for that, right? And then there's no services in Nevada. Unfortunately, we had cut mental health services in the 90s, and we never caught up. And so where were the law enforcement taking after that 911 call? They would respond. Where were they taking everyone? To the emergency room. And so we had to do something about it. And so for me, it was bringing together our law enforcement and our healthcare so that they started working together. So we started really figuring out how we get social workers and mental health workers working together. What I know from my background was that we had to get people off of that 911. Right? It is not appropriate for somebody who's in acute mental health, and it's not fair to them to have them call 911 and you have law enforcement respond. We see the results of that. So it was a couple of things. So in Senate Finance, it was important for me to partner with my colleagues to, one, find this, really fund the new 988 hotline and start letting people know about it so that actually on that end, we have mental health providers that are providing acute care and support for them. But that was one piece of it. The next piece was, and this was partnering with Senator Wyden, because he has the CAHOOTS program in Oregon, mobile crisis intervention units. So when that call is made, if there is a need to send somebody out, you're not sending law enforcement, you're sending people in the mental health field to respond. So we put funding in the budget for not only the 988, but we also put funding in to create these mobile crisis intervention units across the country. Here's what I do know, and you all know this because you're in this field. It starts with the crisis mode. How do we address first that first call on the crisis side of it? How do we bring stabilization? And then how do we build out the continuum of care for mental health at all levels? We have a long way to go. For me, it was starting with that crisis side of it. Nevada's fortunate, and let me just say, before I forget, when I say bipartisan, a lot of this work has been done even before I got there with certified behavioral health centers. That was Debbie Stabenow and Roy Blunt, working to put funding in for certified behavioral health centers. There were a few of them across the country. Nevada was fortunate. We had one of them. We have since put more money in to grow the certified behavioral health centers. That's part of that continuum of care. But that first call, that first interaction is the key. That's the crisis stabilization. That's the crisis mode. And that's unfortunately where a lot of people come in through that door. And we have to have services to support that. We also have to have funding sources. Right? It's one thing to make the call. It's another to have funding that's going to support so many people coming around to help that individual.
And the funding plays into awareness of this because that's the battle now, is getting the education out there. And we talked on a panel earlier, like there still has to be more appropriations to let people know this is a number you can call, and it's a memorable number to call.
That's right. And so part of this is education, letting people know. But here's the thing, and this is the legislation that you talked about that I'm working on, is how do we get Medicare to fund that first 23 hours of crisis mode? That's really where I'm at right now. There should be more funding sources to help people when they come in that door. They don't have to worry about it. Medicare, Medicaid, at least from my perspective on Senate Finance with Medicare, how do we get that opportunity to really help those individuals in those first 23 hours when they are in that crisis mode. Let me just give you an example, because I'm a data person. I like to see the data. You know, we have Nevada Crisis Support Center that is actually one of, it's based in northern Nevada. It is the other end of the line when somebody calls 988, but it is also one of the national ones that picks up for calls nationally. And last year they had 87,000 calls. 37,000 were just from Nevada. And I suspect that as we get the 988 hotline out there, that is going to continue to grow. But think about this, every single one of those calls, what do we do with those individuals? Where do they go? How do we help them? What's the next step for them? And it's one thing to have the 988 hotline, but if you don't have services to put them into, what do you do? And that's where we grow this. That to me is the essential part of all of this. I have to, this is such an important issue for me. Every time I go home, I talk to folks about what we're doing in the state of Nevada. I just visited, when I was home last week, Desert Winds. It is the first residential care facility really that we have now for our kids, and they are just opening a wing for adults. And they've been open about a couple of years now. And it's fascinating to talk with them, because I will tell you the care for that, once the crisis mode and then you put them in that first kind of step of residential care, is that assessment mode. How do you identify what their needs are right? It's evidence-based, you all know this. It's based on the individual. It's not what a textbook tells us what we should be doing. It's what those individuals need, and that's what this facility is doing for a lot of the young kids that have come through. And you know this, and you all seen this, especially after this pandemic. I can't tell you how many young people that I have talked to during the heart of the pandemic and after that have impacted mental health needs. And I remember sitting with some high school students. We were on Zoom, and I pulled a bunch of school students together throughout my state to talk to them. Let me just tell you, I now understand why we see a need across the country for so many students for mental health, just what they told me, right? Now I go to this Desert Winds, and I'm talking to a lot of the staff and the doctors there, and they're talking to me about the young folks that are coming in and the individualized care they are providing based on that need. Let me give you an example, and this is something that they talked about, so I feel comfortable to talk about it. Young woman came in, self-harming herself. How do we address this with a young person so that they're not harming themselves? How do we treat them? What they did is they gave her an apple. And they said to her, every time you feel like you need to do self-harm, peel the apple. So that she was peeling the apple and not harming herself. That was part of her care and rehabilitation. And so they are thinking ways, how do we individually focus, whether it's through that, whether it's through art, whether it's through pets and animals, whatever it is, whatever that need is. And that's what we want. That's what I want. But the challenge is we also have to grow our providers. We all know there's not enough healthcare providers for your physical care in, let me just tell you, in Nevada, let alone your mental health, and that's another piece of all of this.
When you talked to the children on that Zoom call, what struck you?
Every single one of them did. And, you know, I think this is what struck me, because as somebody who went through the public school system in my state, didn't even think about this. But after listening to them, you realize how much your schooling and going to school has an impact on your growth and your socialism and your ability to feel not isolated, but connect with others. And that social connection, that was key. And it had an impact on our students. And it had an impact on their ability, whether it's their sports or their extracurricular or their academia or just the socialism when you go in there and you're talking to students and socializing, it's a positive and it helps with their growth. And that was the number one thing that struck me amongst all of them, because that was consistent with what I was hearing from these students.
What is and I think it was great that you mentioned bipartisanship, because mental health affects Republicans, Democrats, rural, urban. And it is a bipartisan issue, and the media, I don't think, really, we kind of focus on the fight a lot of the time, but there is bipartisanship. What's the pathway for your legislation? Are you looking to attach it maybe to an appropriations vehicle or something along those lines?
Yeah, so what we've done in the past with a lot of the stuff that I've been able to pass is get it through appropriations or an omnibus or something that we can move, and we'll try to pick pieces of it and move it forward, and we'll continue to do that. I think my goal is to figure out whatever vehicle I can attach certain things to and get it done. It'd be nice, and you know, I'm not opposed to actually having some sort of mental health legislation come out of Senate Finance. I'm still hopeful, based on the subcommittees that we've created in Senate Finance and paired up R's and D's on the various subcommittees. There's work being done in white papers that are being pushed out. I'm hopeful at some point in time we take a good chunk of those and put those into some sort of legislation as well.
You have a very busy schedule. The Senate has a large agenda before it's scheduled to go on recess. Why are you here now? Why are you talking about this? Why is this so important to you?
Because I think the more we can educate and talk about this issue, the more that we can get resources into our communities. And one final thing, let me say, this is so important. I think the more we talk about it at all levels, whether it's for our kids, whether it's for young adults, I've done a lot on first responders too, work around helping the mental health issues for our first responders. The more we talk about it and other people hear about it, we're destigmatizing it. That's the key. That's the biggest hurdle right now, is the stigma associated with receiving some sort of mental health care. I'll know we're successful when you actually can go and feel comfortable to go get physical health care or mental health care, and there's no distinction between the two. That's the other piece. One final thing, the integration of our physical and mental health. That's another piece of legislation that I have. There's funding that I have fighting for to put out there for some of our providers to help them with that first step of integrating the physical care and the mental health care within their practices. To me, that's part of that destigmatizing this mental health, because really it is about healthcare in general and what we should be doing to provide essential services.
Have you experienced more people willing to open up, maybe post-COVID, than they used to?
I think so, because I think what I see, many are realizing that at least the pandemic has had an impact, and they can cite to that and look to that to say, I need some help here. It does help when we have sports stars or stars or whoever talking about their needs as well.
That helps.
Right?
Yep.
And so I do think it is part of this discussion that we have to really still continue to focus on providing health care. And when we talk about health care, we talk about both your physical care and your mental health care.
Senate Finance has vast jurisdiction, healthcare, taxes, trade. I was saying earlier that since I've been covering Congress since 1995, this is one of the biggest success stories of government. Can you put it kind of in what your views are?
For the mental health piece
Yeah,
of it?
getting
Absolutely.
988, getting the
Listen,
bill passed
well,
pretty quickly, actually.
Yeah, let me say this. This is the first time, and you guys can check me, and you'll check me on this, but my understanding is last administrative budget, that was the first time we had seen so much money the administration had put in towards mental health. I want to say it was a 25% increase. I mean, and if you decide, and most people say, well, your budget is usually what you value. There's a value towards addressing mental health needs in this country. So that's the first step, and then more of Congress really focusing on how we push those essential resources out there. That bipartisan support behind 988 is a great statement. That we really value this idea of helping individuals and providing resources for them to reach out when they are in acute crisis or they need some sort of help for their mental health needs.
As you know, we're looking at a potential government shutdown. There's big fights over funding. We had a big bipartisan debt limit agreement, and now there are disagreements about the agreement. Do you think that Congress is going to be good in this area, because this is not a 1 year, 2 year, there's no finish line on mental health?
Yeah, that's my hope. Is what I see. I can't speak for the House side. I can speak for the Senate side. What I see is this bipartisan support continuing around the mental health. Because, listen, it's not unique to Nevada. What I'm seeing, and I just talked about, it is happening across the country in every community. And so if I'm seeing it, my colleagues are seeing it. And there is a need for us to work together really to provide these services that are essential for our communities.
Well, we've run out of time. Please thank the Senator for joining us. Thank you so much.
Thank you, guys. Thank you.
Thank you. Thank you so much.
Thank you, Senator Catherine Cortez Mastro and Bob Cusack, and a big thank you to all of our guests this morning. That brings us to the end of our program. On behalf of the Hill and our sponsor, National Alliance on Mental Illness, we would like to thank everyone who joined us here and in person, and those of you who tuned in online. If you missed any portion of today's discussion, the full video will be available on thehill.com shortly. Thank you, everyone, for joining us.